everyone. My name is Dr. Janet Moradia. Today we are with Dr. Manu Parmar sir, Professor and Head of Psychiatric Department. So friends, today is 7 November, National Cancer Awareness Day. Cancer awareness is the key to early detection and better health-seeking behavior. Cancer is quite common in both developing as well as developed countries. Poor awareness may lead to poor uptake of screening modalities and delay in diagnosis. Cancer is a global disease and spreading rapidly. In low and middle income countries, patients with cancer generally have a poorer prognosis compared with a patient in a high income countries. Cancer is a one type of terminal illnesses. Terminal illnesses like advanced cancer, organ failure like heart failure, neurological disease like Alzheimer's disease and other dementias, Parkinson disease, motor neuron disease, multiple sclerosis, cardiovascular disease, other conditions like HIV, AIDS, stroke, muscular dystrophy, chronic lung disease. Cancer is a leading cause of death worldwide, accounting for nearly 10 million deaths in 2020. Cervical cancer is the most common cancer in 23 countries worldwide. Male to female incidence rate ratio of approximately 1.4:1 for all cancers. Now, what is psycho-oncology is covered by my colleague Manu.
Myself, Dr. Joshi, and today our topic is psycho-oncology. Cancer is strongly linked to a psychiatry, as a diagnosis can cause significant mental health challenges like anxiety and depression for patients and their families, and psychiatric disorders can impact cancer outcomes. These conditions are common, with adjustment disorders, depression and anxiety being the most frequent psychiatric disorders. It is a specialized field known as a psycho-oncology that focuses on the mental and emotional needs of cancer patients. Common psychiatric issues in cancer patients can be anxiety and depression, adjustment disorder, delirium, sleep and eating disorders. The treatment and management for these disorders can be psycho-oncology to manage the psychological and emotional needs of cancer patients throughout their journey. Medications such as antidepressants and anti-anxiety drugs to help manage the symptoms. Non-pharmacological interventions like counseling and group therapies and other interventions are also used to help patients cope up with psychological distress. And early screening. There is a growing emphasis on regular screening of cancer survivors for psychological distress and psychiatric problems. Now,
myself, Dr. Smith Hada. I am giving up the topic with palliative care in diseases such as dementia and Alzheimer's. Palliative care, a holistic approach to comfort and dignifying patients' life in serious illnesses. Psychopalliative care in diseases such as dementia and Alzheimer's disease. Alzheimer's is a disorder for which the patient forgets their own names, relatives' names, their home address, and may run away from the home many times. Alzheimer's disease causes prolonged psychological suffering due to progressive loss of memory, identity, and independence, causing emotional distress and anxiety and depression in early stages, as well as hallucination and delusions in middle stages, and total dependence and loss of communication in advanced stages. Families also experience chronic grief, guilt, and burden of patient many times. Psychological dimension of care in Alzheimer's disease or dementia diseases. There includes the main points are symptomatic relief to the patient, behavioral management of the patient in early stages, anxiety, depression, and psychosis management, communication and connection with patient despite their decreasing memory, counseling for family members and caregivers, guidance for hospitalization and life-sustaining measures for patient, helping families find a meaning and accepting the life of the patient. A special topic on the role of psychology in palliative care. Psychological assessments are done in palliative care methods. It embarks to identify anxiety, depression, fear, and distress in patients that are early in onset of illness, crucial for the tailoring of palliative interventions. Emotional support and counseling. It provides individual and family therapy, help patient face fears about pain, dependence, body imaging, and death. Spiritual and existential care. patient feel loss of meaning in their life or say that their life doesn't matter in this world. Psychological intervention help them with the spiritual aim of the palliative care. Support for family and caregivers to accept the fate of the patient. Thank you.
Hello everyone, my name is Dr. Manu. My today's topic is why mental health matters in patients with heart disease. Cardiac and psychiatric conditions often influence each other. Depression and anxiety are common after heart attack, angina or heart surgery. Stress, anxiety and depression can increase heart rate, blood pressure and can induce inflammation which even worsens the heart condition. So psychiatric treatment is considered a key part of cardiac rehabilitation. Effective psychiatric treatment in cardiac patients involves three coordinated components. First component is psychotherapy, which consists of cognitive behavioral therapy, which helps reduce the anxiety and depressive symptoms. Stress management technique, deep breathing, exercise, mindfulness and meditation are also helpful. Second component is medication, in which SSRI, which is selective serotonin reuptake inhibitors, are safest for heart patients. For example, sertraline and escitalopram. And benzodiazepines are also useful in short-term anxiety relief. Lorazepam is the safest. Third component is lifestyle and social support, which includes encourage of smoking cessation, alcohol avoidance, salt restriction in diet, healthy sleep cycle, and structured exercise pattern. Thank you.
Okay, thank you.